At 21 years old, Emma thought she had found her calling when she took a job at a Medicare-funded nursing home, planning to use the experience before nursing school. What she discovered instead was a healthcare nightmare that would shatter her dreams and force her to question everything about compassion, responsibility, and survival. The facility was a place where hope went to die. Half the time, residents shivered through cold showers because there was no hot water. State reports piled up like autumn leaves, documenting violation after violation, yet nothing changed. The stench of neglect hung in the air like a permanent fog, and the walls seemed to absorb the despair of forgotten souls. Emma's hall was the worst of all. 19 to 21 residents assigned to her alone, most of them morbidly obese and requiring specialized equipment that legally demanded 2 staff members to operate. But there was never a second person available. These vulnerable human beings lay trapped in their beds, day after day, their dignity slowly eroding along with their skin. The facility provided only rough, scratchy washcloths for the most intimate aspects of patient care, cleaning after bowel movements, tending to bodies that couldn't tend to themselves. Every other aide had learned the cruel mathematics of this place: spend your own minimum wage paycheck on wet wipes, or watch your patients develop agonizing bed sores that would never heal. Emma watched her colleagues empty their pockets month after month, buying basic supplies that should have been provided by the facility. They whispered about it in the break room, how they skipped meals to afford wipes, how they chose between gas money and patient comfort. But they did it anyway, because the alternative was watching human beings suffer. Then came the report that changed everything. Emma's hall showed the highest rates of bed sores in the facility, angry, infected wounds that spoke of systemic failure. The administration needed a scapegoat, and they found one in the young woman who refused to subsidize their neglect with her grocery money. The shame campaign began immediately. Administrators who earned 4 times her salary pointed fingers at Emma's selfishness. Her fellow aides, already stretched to their breaking point, turned cold shoulders to the colleague who wouldn't play by the unspoken rules of this broken system. If you cared about your patients, you'd buy the wipes, the administrator declared, her voice dripping with manufactured moral superiority. The weight of judgment pressed down on Emma's shoulders like stones. She was trapped between her own financial survival and the suffering of people who depended on her. But then one nurse, witnessing this public humiliation, spoke the truth everyone knew but refused to acknowledge: maybe someone making 4 times her salary should be buying them instead. The room fell silent. The administrator's face flushed red before she hurried away, her hypocrisy exposed for all to see. Now Emma stands at a crossroads, questioning everything. Is she truly heartless for refusing to bankrupt herself for basic supplies? Or is she the only sane person in an insane system that exploits both workers and patients while those in power count their profits? The bed sores continue to fester. The patients continue to suffer. And somewhere in a corporate office, executives discuss quarterly earnings while human beings lie forgotten in rooms that smell of neglect and broken promises. What do you think? Should healthcare workers be expected to fund patient care from their own paychecks, or is this young woman right to draw the line? Share your thoughts. This conversation needs to happen.